tricep, and I would hold it like this right here and hit it with a hammer to see if he had a good reflex. And then I would check the tricep by hitting with a hammer right here. Now I'm going to check the brachioradialis, and I would hit it with a hammer right here. Next, I would do the quadricep, both knees. Keep it out. There you go. Good job. And as well as the Achilles and clonus. Okay, next I would also check the abdominal reflex and the plantar reflex by taking a pen and doing a light stroke on his foot to see if he would bend his toes. Now, I'm going to check your belly. Can you lay back for me just a minute? Put your head right here. Good job. All right. His belly is soft. It is flat. Does your belly hurt? You have any tenderness in your belly? No? It is symmetrical. His umbilicus is normal. It's not protruding. His skin is pink, dry, and warm. He has no pulsation or movement, and he has normal hair distribution. His demeanor is relaxed, and he has slow, even respirations. I'm going to auscultate. I'm going to listen to your belly now, okay? In all 4 quadrants. I would also note any vascular sounds by listening to the aortic, the left renal artery, the right renal, and the right and left iliac. There are no vascular sounds noted. Next, I'm going to percuss all 4 quadrants. I would also percuss the borders of the spleen for dullness and check the costovertebral angle tenderness. And how I'm going to do that is, can you sit up for me just a minute? Just sit straight up in the bed for me. Do you have any tenderness there? Any tenderness there? Okay, lay back. Now I'm going to touch his belly again to see if he has any tenderness. I'm going to palpate in all 4 areas, all 4 quadrants. First I'm going to do light palpation, then I'm going to do deeper palpation. And I would also palpate for the liver, spleen, and the kidneys. And the aorta. I'm going to check for a fluid wave. Can you put your hand in the middle of your belly like that right there for me? Good job. And he does not have a fluid wave. I would also check the inguinal area for any nodes, pulses, or the hernias. All right, you can sit back up in the bed for me if you want to. We've had you over, haven't we? Okay, now I'm going to check all of his joints. While I'm checking the joints, I'm going to inspect for size and the contour of the joint, any skin color. I'm going to palpate the joint and check for range of motion. First, I'm going to start off with the temporomandibular. Can you open and close your mouth for me? It is of normal size. He has good range of motion. His skin is intact. I'm going to check the cervical. Can you move your head from side to side? Up, down, and this way, like this. Good job. His skin is intact. He has good muscle tone. There are no bony articulation. Next, I'm going to check the shoulders. Put your arms out for me. Can you put your arms back like this, down to your side, all the way up above your head? Okay, good job. He has good range of motion, is able to adduction and abduction, has good muscle tone in his shoulders. The size is normal. Next, I'm going to assess his elbows. Do you have any pain when you move your elbows? He has good range of motion, normal size and color. The skin's pink, warm, and dry. He is able to flex and extend. Next, I'm going to check his hands and wrist. I'm going to do the Fallon's test. Can you hold your hands like this for me? Do you have any pain when you do that? Okay. Now I'm going to check, I would also check his hip. Can you lay back for me again? He's able to adduct and abduct his hip. Can you bend your knee up for me? Now let's do the other side. Can you bend that one up as well? I would, again, palpate and assess color of the skin. Now I'm going to check the knees. Skin is pink, warm, and dry. There are no abnormalities noted. He does have good movement of his knees. I'm going to rotate the leg out and check for McMurray's test. Now, next I'm going to assess the ankle. He has good range of motion. Skin is pink, warm, and dry. Joint seems to be intact. I would also assess his foot using the same steps I have used with the other joints. Inspect, palpate, and assess range of motion. Now, I need you to sit up one more time for me, okay? Okay. I'm sorry, I don't. I need you to lay back down. I need to check the Lassig's test by having him raise his leg up to a 45-degree angle straight up. Can you do that? You got it? Okay, good job. Down. Now do this one as well. All right. Good job. That is all. That is the end of the assessment. Thank you.